A gastroscopy is a flexible fibre optic scope examination of the esophagus, stomach and duodenum. The patient is given sedation and placed in the lateral position. The scope is then passed through the mouth, over the tongue, to the back of the throat and then onto the pharynx. It is then passed behind the larynx to the junction of the pharynx and upper esophagus, into which it is passed under direct vision. The scope is then progressively introduced into the mid-esophagus and then into the lower part of the esophagus. Are relayed to a monitor which is just out of view on the right-hand side of this picture. The tip of the scope can be maneuvered up and down and side to side by a set of controls, thereby allowing it to turn corners. The stomach is entered via the gastroesophageal junction, and in this particular case the lining of the stomach appears entirely normal. The exit of the stomach into the duodenum, otherwise known as the pylorus, is seen here, and the scope is gently passed through into the first part of the duodenum and then onto the second part of the duodenum. This is the beginning of the small bowel. Biopsies can be taken by passing a fine wire with small forceps attached down a separate channel in the scope. This allows small fragments of the lining to be taken for analysis if pathology is suspected. This can be repeated in the stomach and the esophagus as required. Finally, the scope is turned through 180 degrees, and this allows full visualization of the top of the stomach, otherwise known as the fundus, which in this case appears entirely normal. The scope is then slowly withdrawn, all the while making a careful examination once again of the lining to ensure that no pathology has been missed on the way in. As it is withdrawn up the esophagus, the heart can be seen beating through the wall of the esophagus, where it is in very close proximity to the esophagus in the chest. The scope is withdrawn into the upper part of the esophagus and then into the pharynx. And at this point, an excellent view can be obtained of the larynx and the vocal cords, which lie just in front of the pharynx. Once the scope has been fully withdrawn, the patient is transferred to the recovery room, where they remain until entirely independent. They are then permitted to return home in the company of a responsible adult with whom they should stay for the remainder of the day. During this time, they should not drive a car nor operate machinery. The following day, the patient should be completely back to normal.